Today we're going over sexual abuse, and I figured what better than to interview someone who does this every day. So can you tell me your name and what you do?
My name is Detective Sergeant Scott Peel. I'm with the Wayne County Sheriff's Office, assigned to the Special Victims Unit, and it is a part of investigations.
Okay, so related to sexual abuse, what is the scope of the problem?
And you can look online and see statistics and data, but it's usually like 1 out of 4 of sexual assaults are only reported. So you're looking roughly 23% of people that report when they have been sexually abused or raped. Usually approximately 8 out of 10 rapes are committed by someone they know. I know one of the last ones I had was a little girl who was molested by a family member. And here again, a lot of them are people that you know. It's just not a stranger with the cases that I've investigated.
So it could be a family member or a family friend.
Absolutely, it could. And that's where the family dynamics come in. And of course, we work together with social services, because when you have family members, their social services primary is the safety of the child, where we work hand in hand with them because we're looking at the criminal aspect of it. So we do talk with the DEA's office and then see what needs to be done there as far as any charges or whatever.
Okay, can you talk about the cycle of the violence and how it kind of happens?
Yeah, the cycle of violence, what we have found out is when children have been molested, when they grow up, sometimes that they become predators, and then they do the same thing that was done to them, and then they start molesting other people as well.
Okay, what are some characteristics of the victims, adult or children?
As far as victims that are children, some of the characteristics are that children rarely make up stories like this. So when we've had 5 and 7-year-olds come in and start talking about things that they shouldn't know about, and then they start giving you a lot of detail, a lot of times you can pretty much count on something's going on there, something has happened to that child. And a lot of times one of the other characteristics is children are embarrassed. They, number one, they're embarrassed of what happened because they know it's wrong, and a lot of times the predator will tell them, don't tell anybody or you'll get in trouble. And another characteristic is they feel like being children, that no one will believe them. As far as adults that are assaulted, I've had ladies tell me that they were in so much fear that they were scared to fight back. So they wouldn't fight back in fear that the person would start getting more physical and hitting them and striking them and all. So they just wouldn't fight back or anything. And as far as characteristics of suspects, most of the time suspects, they cannot stop their behavior on their own. It's just something that they have to get help for until they get caught. Going back as far as the adults that are assaulted, people a lot of times rape people not for sexual gratification, but it's because of the power, the sense of control. And we see that a lot in our cases.
So the suspects and the victims both would need some sort of counseling.
They would.
Get through this.
They would.
How do you detect sexual abuse?
There's several things, and of course people are different, so people are going to have different, reactions. One is a person may have nightmares, they're unable to sleep, sudden mood changes. People sometimes refuse to eat. Other people start eating all the time. New or unusual fear of certain people. I recently had a case of a little child that was scared to go to men, and then come to find out later it was because her uncle had been molesting her. People sometimes run away from home. They even sometimes attempt suicide.
Okay. What about treatment for the victims and abusers? I know we said therapy earlier would be a big treatment. What else could we do for these?
Well, the victims that are sexually assaulted or raped, they're affected mentally and physically. I was never a big fan of people going and getting therapy until I started working in the special victims unit, but I highly recommend that the victims get some kind of counseling because it's part of the healing process. And the family is also included in that. A lot of times the family, they have to get therapy as well and help them cope along with the victim.
Okay. So us as nurses, what can we do to assist y'all in helping these victims?
A lot of times when I have interaction with the nurses, of course, is in the emergency room or the ED, emergency department. And that's when the victim has come to the emergency room and is being seen. One thing that nurses do that assist us is collecting evidence. A lot of times the nurse will, when they're putting gowns on, hospital gowns on the victim, they will take the clothing which can be used as evidence. And what we suggest, and nurses do it, is of course wear gloves so DNA is not transferred from them to the clothing. And they also put it in paper bags. We always request paper bags because if you put clothing that has fluids on them in a Ziploc bag and it's sealed or whatever, it tends to have bacteria grow faster. In a paper bag, of course, it will, breathe a lot better.
Mm-hmm.
And then you have the chain of custody is important. We have a rape kit test that either a forensic nurse will do or a doctor. But here at Wayne UNC, my interactions with them is the doctor will do the rape kit test and the nurse assists. Documentation is important because when it goes to court, you have the nurse, you have the doctor's signature, the nurse, and of course the information. A lot of times the nurse will fill that out outside the rape kit test and it'll be transferred. It's part of evidence. So it'll go from that nurse to a detective such as myself, and it's called the chain of custody.
Okay, so do nurses testify in court regarding assault cases and sexual abuse?
Yes. At times the district attorney, especially if one goes to trial and you've got 12 jurors sitting there, a lot of times the DEA, district attorney, will want the nurse and or doctor to come in and testify what they saw, what they documented. My experience is district attorneys don't like to, pull these professionals from their work, but at times it's necessary to let these 12 people actually hear these witnesses, such as nurses and doctors.
Okay, and can you tell me also about a dying declaration?
Dying declaration is, most times in court, if you say, okay, I want to tell you what somebody else said, you can't use that in court because you can only testify what you do. Dying declaration is recognized in our court system where somebody that is dying and has died, and they tell you ABC, they tell you who did this to them, you can use that in court. So if you as a nurse were in there and you heard somebody say, John Smith did this to me, you as a nurse can testify that this is what that person said. That's dying declaration.
So that would be like us advocating for our patients even after they have passed.
Yep. Since they're not here, you'll be here speaking for them on what they said. Yep.
Do you have any more advice on nurses and sexual abuse cases?
The only thing I can think of, again, is good documentation. A lot of these cases go to court. It's usually average 2 or 3 years at least, and you can't remember so many people that you see. You can't remember everything. So good documentation is what you as nurses do as well as investigators. You have to go back and see what you actually documented and testify to that.
Okay. Well, thank you for your time.
You're welcome.